Seasonal malaria chemoprevention is the administration of anti-malarial drugs in a full treatment course to a population, in this case of children, who are at risk of malaria, at high risk, during just the part of the year when that risk is highest, without testing everybody to see whether they have malaria parasites in the blood. And so this is very similar to what the tourists do, which is called chemoprophylaxis. It is very effective because we've shown in clinical trials done in Mali and in Burkina Faso, in Ghana and the Gambia, that it will reduce both the most severe forms of malaria that would lead a child to get into hospital and the less severe ones, which would perhaps just lead them to go to a health centre for treatment, by about 80%. One of the differences is that with seasonal chemoprevention, you give a full treatment course, the same course as you would as if somebody came to the clinic with fever and malaria parasites. And indeed, some children probably will have some clinical illness if in the community who haven't been quite sick enough to go to the clinic. And that drug then lasts in the blood long enough to give protection for a month, and then they get another treatment, and in most places this will be done perhaps 3 or 4 times. In chemoprophylaxis given to the tourists, very often people will take the drug more frequently in a smaller dose. World Malaria Day is important in reminding people that malaria is not going to go away quickly. There has been a lot of progress in the last 10 or 20 years, but the battle is not over. It's going to go on for many, many years, and every year we need to keep reminding people of that.